right, time for the checkup of the day. The CDC says RSV cases are on the rise. RSV is a virus that infects the lungs and respiratory tract. The organization is advising doctors to use the new vaccines for both newborns and older adults this fall. RSV levels began rising in the South in late July. We saw it then. Officials say cases have now more than doubled over the past month, and they believe they will likely increase across the rest of the U.S. in the weeks and months ahead. It appears President Biden has not been infected with the coronavirus. He tested negative on Tuesday. However, the president will continue to test and wear a mask while he's around others. This comes after rising COVID cases across the country, now including the First Lady, Dr. Jill Biden. The White House press secretary says that the First Lady has mild symptoms and will stay in Delaware to quarantine. And with the rise in COVID cases right now comes concern, particularly as our kids are heading back to the classroom. Recent surges of COVID and other illnesses have prompted districts in Texas and Kentucky to briefly pause in-person class. One of the issues school officials are contending with is the lack of comprehensive COVID surveillance data. They also say they don't have much guidance on the federal level, so decisions on mitigation measures are largely up to school district leaders. Joining us to talk more about this, emergency medical physician and medical director, Dr. Richina Bichette-McCain. Doctor, good to see you as always. What's your messaging, your medical message to school districts and also parents as we send our kids back to the classroom and we're starting to see some COVID cases rise?
Marni, I think that everyone should heed the potential warning that we're seeing right now. It's like when you go outside and you see clouds that could potentially bring rain, you pack an umbrella just in case. The problem with these rising numbers is that we have no idea which way they're going to go. We could hit a plateau next week in case it could start to fall, or they could continue to exponentially rise with the new variants that we are seeing.
Do you think we should have more federal guidance from the CDC to school districts as they try to mitigate the spread of the virus?
You know, Marni, I think this whole pandemic has been so politicized that any attempts at federal guidance is met with behest and extreme hate and impringements on personal values and belief systems. That's not what this is about. We're really just talking about the health of our children, the health of our country. So I absolutely do think that the CDC should do a little bit more to impart some federal guidelines to school districts, especially because these are educators. They don't have a background in healthcare. They shouldn't be forced to have to make these decisions.
How about home testing? We've kind of gotten out into the habit of doing it, but should we have home tests available to make sure so we're not sending anybody to school or work who has COVID?
Absolutely. Since the public health emergency was ended in May, there aren't as many sites that are giving out ample amounts of home tests. But what the FDA has said is that if you have home tests that are potentially expired, check their website, because a lot of these tests now have extended expiration dates. At the onset of the pandemic, when the home tests were developed, we had limited amounts of data. So to err on the side of caution, we gave these tests a little bit of a shorter half-life. Now that time has passed and we have more data about the sensitivity and safeness of the test shelf life, some of these have been extended, so you should be able to use them still.
Yeah, and use your common sense in all these cases. We've been talking throughout the morning. Senator Mitch McConnell is going to be in a closed-door meeting today. The Capitol physician, Dr. Brian Monahan, says he doesn't think McConnell had a stroke or a seizure when he paused several times in the last couple of weeks. He's 81 years old. He froze on camera for a second time in 2 months. The doctor also says there's no evidence that he has a movement disorder like Parkinson's disease. I guess my question to you is, what types of tests might they be running? Because something is clearly going on they're trying to figure out.
That's what I think, Marni. Something is clearly going on, although we don't know what it is just yet. From what I've read, the only test that's been alluded to in the physician's statements is that Mitch McConnell had an MRI, which is a scan of the brain that's great for detecting evidence of old strokes and actually can pick up evidence of new strokes within hours or minutes of onset. So although he may have had an MRI that wasn't particularly abnormal, we don't know what other tests he's had. Has he had an EEG EEG, which is an electric monitoring of the brain that can capture seizures when they're actively occurring? Has he had an EKG to check his heart rhythm? Or has he been prescribed a Holter monitor, which actually records every beat of the heart while you're wearing it for a period of anywhere from 24 to 30 days? So there are other tests that I wonder if they've pursued or if there are other things they are currently pursuing. But I agree with you, Marni. Something definitely is going on here.
Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.